is Tracee Chapman. I am a nurse and nurse educator, and my current role is I am the Director of Simulation-Based Education and Research at the university where I work, and I get to work with pre-licensure and graduate nurse practitioner students in 3 different programs. And it is a lot of fun getting to see students grow from brand new nursing students to graduate nursing students. And I am really excited about some research that we have being published this year, and we're working on preventing human trafficking. And I've written 3 book chapters with some colleagues over the past year that will be published this year. So we have big things coming out of our university, and it's pretty exciting. My nursing journey started out because I was traveling a lot with my previous employment and I was never home. So I came from a family of healthcare providers where my stepdad was a physician, my mom is a nurse, and nursing just felt like a really natural fit once I started taking a couple of the prerequisite courses. And I did do my undergraduate all in person in a brick and mortar building. And really, when I left the emergency department and became a school nurse, I had the opportunity and the time to pursue my education a little bit further. I got to choose being in an online program because it really fit my family. So my master's in nursing education has a really unique way of approaching. It was 1 class every 5 weeks, and you just completed the program in that way. So I was never feeling overloaded working full time and doing this master's program. And when I was looking for my DNP program, kind of the same thing, working full time, I have kids, and I needed something that fit my life. When I first started my master's, I purposely chose a school that was both having in-person nursing programs and online. So I really wanted to have an experience with a program that was supporting both roles. So I really thought that I would be spending a lot of money and not a lot of interaction from faculty. And it was completely the opposite. Yes, degrees cost money, but my experience with my master's program was that the faculty were so invested in what we were doing and the work that we were producing as nursing students that I was really shocked that they cared so much and they personalized everything, and it made me feel like I was actually on campus even though I was online. Online classes helped me maintain work-life balance because I could study when I wanted and I could put my little guy to bed and still get homework done. Having the flexibility of doing work and studying on my timeline was really important to our family. And when I started my DNP, there's a lot of clinical hours that go with that. So, finding time during the day to do homework wasn't always a reality because I was completing my clinical hours. So I did a lot of homework at night after the kids went to bed. And it's just how we got through. And it was a good balance and worked for us. The best thing about learning online is that you are doing work that's not always just traditional paper or showing up, listening to a lecture, taking notes. Faculty have gotten really innovative in how they deliver education. So you might do an unfolding case study online. You might participate in a virtual simulation. So there's lots of ways to engage with the materials that is just not going to a lecture and taking notes. So it was really personalized and a much better journey. This is a really big deal. is finding connection and support in a program. I will tell you that I currently work with 2 people from my master's program, and we started working together in small groups doing our little projects, and we have become really great friends, and now we're colleagues. So that relationship started in our master's program. And I encountered the same kind of support in my DNP program. So I was partnered with one other nurse, and she and I were like peer reviewers of each other's work to make sure that our writing looked good and that we were interacting with people in our groups. And my professors, we met with them about once every 3 to 4 weeks just to have a face-to-face over Zoom conversation, checking in. Sometimes it was just, let's have coffee and talk about your project. Sometimes it was, we had some very specific things that we were going over. But I felt very connected in my DNP program because the professors were there face-to-face with us over technology all the time. So when I looked at tools for being successful in an online program, I highly recommend using some sort of program that can help you formulate references. It can help check your paper design. We utilized the online library database a lot. So really getting to know the College of Health Sciences librarian and understanding that they can help you find articles and pull information, and just really knowing what is out there and available at the university level was really helpful in being successful. So when I took a job at the university as a clinical assistant professor, I had my master's, and that's what's required to be able to teach at the collegiate level. And I was offered the opportunity to get my doctorate from my employer. And so it was really a great opportunity to just fast forward my career and to just get a terminal degree and be able to do a little more with research and practice, and being able to hold different leadership roles that require a doctorate. If I hadn't done that when they offered, I'd probably still have my master's and not have my doctorate, which would also be okay. But it was a really great opportunity that I was able to take advantage of. I can tell you the most challenging part of completing a nursing degree online is when it came to present my DNP project and, defend what I had done for the last 2 years. It's not the same as getting a PhD. This is really a clinically focused doctorate practice degree. So I had a room full of people on Zoom that I didn't necessarily know. They were independent outside reviewers of my project. And then I had my cohort that were also on the Zoom. And so that made it a little bit more comfortable. But just presenting in an online environment to people that you don't know and sharing your passion for simulation and nursing education. And it was a little intimidating at first, but that was really the most challenging part, was making sure that I was prepared and sharing all of the knowledge that I had gained over the last couple of years. I can tell you that I stayed organized by using my phone calendar and booking appointments with myself to study, to work on my project, or schedule clinical hours. In my master's, it was a little easier because I was only taking one class at a time, and you would just finish that class and then move on. In my doctorate, I was taking multiple classes plus completing clinical hours. So I had to be very intentional about the time that I was setting aside to study or write and attend soccer games, football practice, whatever it was that my kids were doing, as well as balance interacting with my own students while I was still teaching at the university. A Effective time management is the cornerstone of the nursing practice. So I would say that making sure that I kept my schedule and I scheduled care, like self-care time, I scheduled study time, I used my calendar for everything. I mentioned this before, how important it was for me to stay organized that way. It really does impact the quality of work if you're feeling stressed because you don't have enough time to do something. So just planning for those big assignments and knowing that if you need a couple of hours chunked out, that you've got to figure out what are you going to sacrifice. I would say being able to get my master's and my DNP both online allowed me to not only practice at the top of my nursing license, but it improved my financial stability. It improved my ability to critically think in serious situations. It helped me design systems change for bigger picture problems in healthcare. And being able to have a platform to present the research that I'm working on, write book chapters, help students become nurses and be a part of their journey, all of those things were because I chose to continue my education, and I did that online very purposefully. I have quite a few pieces of advice to give for starting an online nursing program. One, it's really important that the program is accredited, either regionally or nationally. It needs to have that stamp of approval that someone else is looking at the curriculum. You want your degree to have value, so that accreditation is really important. And it's really important that you meet with the advisor and that you talk about the culture of the program, because culture exists online and in-person programs. And then reading the reviews of other students or asking the program, hey, do you have someone that I could connect with that's completed your program that would be willing to talk to me? And if you find a university program that's online that will do that, you're probably on the right track. I wish that I would have known that I didn't need to buy all of the books in book form, that digital books were acceptable, that I could do interlibrary loans for some of the books. That would have saved me quite a bit of money. I think that technology has really advanced in the last 4 to 5 years, especially creating digital access and open resource books that more programs are switching to using. So book cost isn't necessarily the biggest thing, but I was paying for school out of pocket on my own, and I wish that I would have looked into that a little closer. I would say for you to make the most out of your online learning experience is to treat it like an in-person experience when you're in the moment, when you're doing homework, when you're writing your papers, when you're working on whatever project it is, or when you're in your clinicals, interacting with patients. Really be present and know that everything that you're doing is going to get you to the end, which is a degree that improves your financial outcomes. It improves your opportunities for professional growth, and to just really embrace the opportunity and the experience as you go along, because there will be hard days where you want to quit, and just don't give up. So nursing education will always have the ability to be successful in person and online. Those pre-licensed students that come to campus, they're learning skills for the first time, they're going to clinicals in their communities. That's really a foundation to set you up for success in nursing. The beauty of education beyond an associate's or a bachelor's degree is that you can get that education from anywhere. You can be in Hawaii going to school from a school in Idaho. You can get your doctorate while in Idaho, but attending a school in Utah. So the growth of online programs is probably the biggest opportunity for students to really thrive and to have access to education. I think that it will continue to grow in both in-person and online realms. If I could give one or two pieces of encouragement, it would be to remember why you became a nurse in the first place and how having an advanced degree ensures that you are practicing at the top of your license, that you are doing what's best for your patients. And yes, it's work. It will take time and dedication, but the benefits of improved patient outcomes, better paychecks, and just a better outlook on healthcare in general and how we can actually fix things and change things and move healthcare forward for patients and for healthcare providers. All of those things are possible with advanced degrees. So take the leap, be strong, believe in yourself, and know that even during the hard days, there's someone there to support you, and that you should definitely reach out to them, ask questions, and be present.